What's better to talk about than morbid obesity? My favorite topic. There's a new study out that says half of all U.S. adults will be morbidly obese by 2030. And there's so much to get into here. This is such a large topic, no pun intended. With Obamacare, a two-tier system, the dangers of these 30 million people being added to the payrolls, who's going to pay for it? Do they have a stake in the system? Preventative care, like Obama says, is giving people preventative care actually a cost saver? I wanted to go to the expert on this, and the expert in the field, who's a genius, his name's Dr. Brad Sarosky. He's the owner and president of Desert Spine and Sports Physicians in Phoenix, Arizona. He deals with complications related to obesity. He wrote a famous paper in the International Medical Journal called The Lancet, which I'm guessing if you're in the medical community is kind of like Us Weekly to me. It's a real big deal. So this guy's very well known. He's very intelligent. He also gets life and he gets the world. And he's going to walk us through not only the problems with obesity and the problems that leads to, but more importantly, Obamacare. And this is coming from an actual doctor on the ground who understands the cost of the system, the rationing of the care that's going to have to take place, the massive deficits we're going to face. And then he's going to answer the time-old question of, does giving preventative care actually save money? I think we're going to be surprised to hear his answers. So I'm about to introduce Brad, but before I do, I have to set up a story that made me want to tackle this study of obesity. And I was at Six Flags Magic Mountain this weekend, and I noticed the lines for funnel cake were longer than they've ever been in my history of going to Six Flag Parks. And also, I was about to ride, this ride was called Viper, and the woman next to me was so large, they had to get like a special harness for her, and it slowed down the ride for a minute. And they make these rides big enough so zoo animals can ride on them. And it just made me think, like, this is ridiculous. So that was just my anecdotal evidence that lines for funnel cakes are too long at Six Flags. There's an obesity epidemic in this country. So to welcome a genius behind all of this, and he's not behind the obesity, he's behind in curing all of these problems. His name is Dr. Brad Sarosky. Brad, welcome to the program.
Andy, thank you so much for having me. What an introduction. Hopefully I can fill those shoes.
Yeah, you'll live up to it, trust me. Remember, you're a doctor, so your brain is 3 times the size of mine. I just have to, it's perception is reality. I have to cover for my own insecurities by being boisterous and telling a joke every second like I'm a clown in a circus. It's my way of getting over that because I'm really in fear of doctors because you have the patience to take the MCAT and sit for 8 hours and go to medical school, all things which I couldn't do on my way to an illustrious talk radio career. Does that make sense?
It does. It does make sense. And
okay.
Before we launch into obesity and Obamacare, I'm concerned about you. Last hour you'd mentioned that you hurt yourself in the gym. I know it's hard staying one step ahead of Brad Pitt. Are you going to be okay?
Well, doctor, I have 2 things to say to that. First, I love the retention of you listening to the program for a full 2 hours. I don't know how you make the time in your medical practice to do it, but I'm not going to ask those questions. I appreciate it. As to me, yes, I do go to the gym. For me, it's not much about muscle building as opposed to muscle maintenance, because when you've been given, the physique like I have, and anybody can see my headshot on AmericaNowRadio.com, it's more about maintenance, if you know what I mean. So, Brad, let's just jump in. As much as I'd like to talk about my own physique, I'd rather talk about morbidly obese people so I can feel better about myself, because when I look in the mirror, I cry sometimes, and it's a reason why I shower with a bathing suit on. Okay.
Sure. So, well, yes, the paper we're going to talk about really is new content. It was published on Friday, August 26th in The Lancet, which is an international medical journal. And it was actually a 4-paper series on obesity, and it presents some really alarming data, both for individuals in America and for our society on the whole. And that is that we're going to go from 99 million people who are currently obese to 164 million in 2030. And the big concern with this, Andy, and I know you have a large brain, and you get this, is that obesity is associated with many, many diseases that are associated with high degrees of morbidity and mortality, such as diabetes, heart disease, stroke, arthritis, and certain cancers. And this increased rate of obesity from 99 million to 164 million is going to be associated with almost 8 more million cases of diabetes, 7 million more cases of heart disease and stroke, and 540,000 extra cases of cancer. This is going to have a major impact on our health care costs. It's estimated that this is going to equate to $66 billion more spent on health care than what we're spending on today, and this is just related to obesity.
Okay, now, once again, we're talking to Dr. Brad Sarosky. He's an expert the owner and president of the Desert Spine and Sports Physicians in Phoenix, Arizona. He helps people with various impairments and disabilities, often as a result of the complications of obesity. And we're talking about America's obesity epidemic. And Dr. Brad Sarosky, before we go into Obamacare and what adding 30 million more people to the rolls is going to do, and the two-tier system it's going to create, the rationing of care, and before you also give us your thoughts on what Obama says is his number one thing, preventative care saves money, I want to get into all that. But first, I want to talk about the driver of why so many people, like the woman next to me on the roller coaster, who must have been, I don't know, 500 pounds, let's say. Okay, this is wrong. I'm getting a lot of people shaking their head. No, okay, I'm sorry. Okay. But look, she did get on the roller coaster. She had fun. Okay, I'll stop. Okay? So, Brad, what do you think is causing this? Because I view it as more as a lack of discipline, because I like to eat. The problem is, I don't eat until I can't see anymore. And I think that everybody blames McDonald's, but what level of personal responsibility? So what angle are you coming at it from? Do you think it has to do with, people don't have access to fruits and vegetables and kids have to eat whatever the lunch lady gives them? Or do you think it comes down to maybe a lack of discipline for people who shouldn't be stuffing their face? Because in reality, if you burn more calories than you consume, something happens. You shrink. Your waistline goes down. So I think it's a lack of discipline. What do you think it is?
Yeah, I actually don't think I agree with that completely, Andy, for a change.
That's good. By the way, that's healthy. I want you to disagree, so tell me what you think.
Unfortunately, I think our environment is obesogenic. And, the soundbite is, yes, as Americans, we're overfed and under-exercised. But to look at things a little bit more critically, I think we have to look at the reason why we're overfed and under-exercised. And, our free market-based economy, or our largely unregulated market-based economy, which you expound the virtues of frequently on your show, I think is partially to blame in this case. And if you look at the food industry, they've become really, really efficient at producing large amounts of palatable, processed, cheap, accessible, convenient, and persuasively marketed foods. I know your favorite restaurant, as you've mentioned before, is the Olive Garden. And
that's correct. But Brad, to your point, I have to interrupt for a second. At the Olive Garden, they post the calories on the menu, and I have a choice between the apricot chicken, which is 400 calories, and then getting the fettuccine Alfredo, with the side of the cheese dip, which is 2,000 calories. That's my choice at the Olive Garden.
It is your choice, but I think that a lot of their marketing is directed towards that bottomless pasta bowl and breadsticks with 6 pastas and 7 sauces.
Don't forget the salad. That's bottomless as well. It's all included in the same deal.
Absolutely. And if you look at their website, which I did before I came on the show, they're featuring, that bottomless pasta because that's really what sells. And, I think that the temptations for some people are too great. I was an anthropology major in college, and I think that, we're designed to eat because throughout most of our evolution, if you believe in that, it was adaptive to eat when food was available. But now food is always available, and it's so cheap and it's so good, it's hard to stop. So really, that's only the first part of the equation.
But, Brad, aren't you amazed, though, that we live in a country that is so free and so prosperous that one of the worst problems we have is people have it so good that we're over-consuming? Because throughout the history of time, people in every society, and even today, look at North Korea, people are starving to death. In America, our lives are so wonderful that we have to watch our waistlines. All things considered, it's like that should be a celebration of the American experience as opposed to poo-pooing it.
I agree with you, but I think, everything in moderation is where we should be. And if you look at some of the greater societies in the history of the world, it's when they become gluttonous and they, get away from a modesty that they get into trouble. So
I would have liked to have lived in old Rome, to be honest. That would have been a lot of fun on the way down. Now, Brad, look, I have to go to break, but I will tell you this. This is very, very important. Coming up, I will do less jokes and less of the Olive Garden stuff, and we're going to get into the nitty-gritty because Brad has a huge brain. He's a doctor. He's an expert in all things obesity and Obamacare, and I want to talk to him about what he envisions as a potentially two-tier system with Obamacare, the rationing of care, and he will finally answer a question that has been on my mind, which is Barack Obama's statement that preventative care saves money and keeping people out of the ER saves money. That may not be true. You will get all of those answers and less of my humor and my shtick and my patronizing affect in the next break, I promise. It's me, Andy Dean. You can visit us at AmericaNowRadio.com. More Dr. Brad Sarosky right after this.
The king of new content strikes again. Andy Dean on America Now.
All right, we're back. Andy Dean, and we got to jump in with both feet because we've got Dr. Brad Sorosky on the line right now. The doctor's the owner and president of the Desert Spine and Sports Physicians Institute in Phoenix, Arizona. He treats patients with various impairments and disabilities, often as a result of complications related to obesity. We're discussing this new study that says more than half of U.S. adults will be morbidly obese by 2030. It's a disaster. People are getting huge. It's making me want to eat during this segment. Brad, welcome back to the program.
Thanks, Andy.
Okay, good. Brad, so I want to jump in about Obamacare. 30 million more people are going to be added to the insurance rolls. Maybe not the healthiest people. Where do you envision this? Talk to me. You said something about a two-tier system. Tell me how you envision Obamacare and the obesity epidemic. Just go ahead. You got the floor.
Well, first, I think from a moral and ethical perspective, it's great that we're adding 30 million more people to be able to get health insurance in the U.S. Many of those are the sickest in society and currently can't get insurance because of pre-existing conditions. The problem is someone has to pay for this. It doesn't come for free. And when you look at who's going to pay for that, it's going to be business owners, individuals through high taxes. Premiums are going to go up. The CBO says that the premiums, because of Obamacare, will increase by 10 to 13%. And then we're going to see a huge reduction in payments to hospitals, physicians, and pharmaceutical companies. And a part of Obamacare is a 20% reduction in payments to physicians. Many people think that this is going to make physicians either drop out of the healthcare system completely and stop taking Medicare and Medicaid, which we've already started to see happen, or it's going to overwhelm the medical system and waiting lists are going to get so long and time spent with doctors are going to get so short that it's really going to crash the system. And probably as a result, you're going to see a two-tier system like you have in England, where if people want better care, they're going to pay cash, and people with money are going to get better services. And unfortunately, I'm not sure that's the direction that we want to move in.
Okay. And once again, we're talking to Dr. Brad Sorosky about the obesity epidemic and Obamacare. And I always like to talk to doctors who have on-the-ground knowledge of what it's actually going to be like, because we know Barack Obama's not a doctor. He doesn't know, what's going on as far as the pricing. And so, Doctor, with 30 million more people attached to these roles, you envision a two-tier system. Now, a lot of people, and this is what Obama's been saying, this is the main contention, that if you give people preventative care and you keep them out of going to the ER, because anybody can go to the ER right now, can get care, but you give them preventative care, that it's going to save the system money. Walk us through that. Do you think that that's true, that fundamental tenet of Obamacare is true?
Yeah, unfortunately, I think it's a false pretense. It makes for a nice soundbite, but when you look at the data and the science behind it, he really doesn't have that to support those claims. The New England Journal of Medicine, which is really thought of by most physicians as the top medical journal in the world, in February of 2008 did a cost-effective analysis study looking at preventative measures. And by looking at the Tufts Medical Center cost-effectiveness registry, they showed that most preventative measures do not actually save money. There are exceptions, telling people to quit smoking, decrease alcohol consumption, improve their diet, make them more active. These things are cheap, and they can equate to savings. However, things such as mammograms and colonoscopies, while they save lives, they actually cost us more money. So there is no cost savings to be had through these preventative measures. Overall, we're going to add more dollars to our healthcare system.
Right. And
yeah, go ahead.
Go ahead. No, please, Brad. Please finish that thought.
Yeah. On the second part of that, when you look at the ER visits, there was another paper studied by the Center, performed by the Center for Disease Control and Prevention, published in May of 2010, that showed that individuals who don't pay for their health insurance, specifically the Medicaid population, use emergency rooms twice as often as individuals that are insured or don't have insurance. So these two ideas, the preventative measures and decreasing ER visits, are going to reduce our costs spent on health care, unfortunately, I think is false.
Right. And look, Brad, and by the way that you said it was so compassionate, and that's why you've got a gift, and that's why you're a doctor, you're a healer, is that everybody wants 30 million people to have access to health care. They make it seem like, oh, big bad Andy Dean and all the conservative party doesn't want poor people to have health care. It couldn't be any further from the truth. We believe in charities, faith-based organizations, all this type of stuff to lend care to people in need. However, adding 30 million unhealthy people to the payrolls means somebody has to pay for it. And so that's the adult and responsible way to look at the system. What happens then? Because if you don't own it, and Brad, just like you said, if you don't have to pay for your own health insurance, then what incentive do you have to stay healthy? It's like if you don't own something, we all know this through the history of time. It's like if I don't own a car, if I have a rental car, I know this anecdotally. I try to do as much damage to that rental car as possible that I can get away with. That's just the reality. But when you own your own car, you don't do damage to it because you're just shooting yourself in the foot in that stupid behavior. The problem is when you just give people something for free, they're going to treat it like a free buffet and go in for all these tests and just enjoy themselves to a luxurious buffet of health care. And the system is going to be overstrained, and you're going to have a two-tier system, like you said, where rich people are going to be able to pay for it and poor people are just going to get terrible care. And I don't know if that's better than having no care. Am I crazy?
No, I think that's right on point. And to that point, why would someone stay out of an emergency room if it costs the same to go to an emergency room or go to a doctor? It takes effort to make an appointment. You may get put on hold when you call a physician's office. You may have to wait in the waiting room. Conversely, if it costs them more money, then you might as well just drive to the emergency room and get your care there, which, of course, as we know, is a more expensive way to get health care. So, unfortunately, I think some of these pretenses where we're going to save all the money really isn't there. And if you look at how much Obamacare, which is what most physicians refer to it as, or the Not-So-Affordable Health Care Act, if you look at what it's going to cost, it's really staggering. And I think Congress sometimes does some fuzzy math to make it look a little bit better. But if you look at from 2014 to 2024, which is really the first decade that Obamacare is going to be instituted, it's going to cost over $2 trillion. And that doesn't even include reimbursement to physicians, which will probably be another $500 billion. So we're looking at over $2 trillion extra dollars in health care over the first decade that Obamacare is going to.
And Dr. Brad, those are projected costs. If we look at any government program through the history of, the past 50 years, whether it be Social Security, Medicaid, Medicare, no government program has ever run on budget or on schedule. It just doesn't happen. And Brad, I hate to leave it there, but we have to. Once again, Dr. Brad Sorosky, Phoenix, Arizona, the man's a genius. We have to have you back on again soon. Your analysis is fantastic. I really, really appreciate it.
Thank you, Andy. Thanks.
All right, Brad. Good stuff. Once again, Dr. Brad, we're going to have him on again coming up.